My name is Marc Weigensberg, and I hope you're having a wonderful conference so far. This session is about clinical mind-body skills. Really, the objective is these are just some mind-body skills that I'm going to share with you that hopefully you'll be able to use immediately in your office with your patients, or if you're not a clinician in whatever form of work you do. Let me spend a few minutes, first of all, just like logistics. If you're on the browser, obviously you're on the browser site because you're here in the room. You may see in the upper, which basically is the objectives of this workshop, and so some bibliography, the outline I'm going to go through. So if you want to, you can pull that up on your screen as we go. You don't have to. And you can certainly download it and print it. Let me just give you a little bit of a background for myself. I'm a pediatric endocrinologist, the director of pediatric endocrinology at LA County USC Medical Center. And I got into mind-body medicine, I think, really through my work with pediatric diabetes, because I quickly realized that the physical medicine aspect, teaching kids how to take insulin shots, check their blood sugars, etc., is really only about 5% of the battle, if you would, for having good balance within diabetes control. But that the biopsychosocial is really 95% of the ballgame. And when I was, I guess it was early 90s, I was invited to and went to a hypnotherapeutic workshop that was led by my first cousin, who was an emergency room doctor. And he kind of opened my eyes to the possibilities of mind-body medicine. So at that point, I was sold and subsequently became certified in interactive guided imagery. And have used it in both my clinical practice and in my clinical research ever since. So what is mind-body medicine? First of all, I tend to not limit it to mind-body, but also to mind, body, and spirit, because I think as human beings, as was made quite clear this morning in those incredible presentations, there is a non-dualism. It's not like there's a physical and then the mind, or physical and the spirit. But in fact, as human beings, we're spiritual beings, and the mind and body are part and parcel of that. I can't be nearly as eloquent in my understanding nor explanation of that as Deepak Chopra or Lisa Miller. But the basic idea of non-dualism, I think that was brought out by both of them, was really important. So the idea that there's a split in the body and the mind, and that as a healer or as a physician, you can just address one or the other, is a real misnomer. So mind-body medicine really is just a medicine that recognizes that fact, that what affects the body affects the mind, and vice versa. So that's basically sort of the concept I'm coming from. I've spent a lot of time thinking about and working on the role of chronic stress in disease, primarily, chronic stress, not so much acute stress, and recognizing the role that mind-body practices can have in reducing stress. So as an endocrinologist, of course, I'm very aware of the chronic stress system mediated by the hypothalamic pituitary, adrenal axis, and then the sympathetic and autonomic nervous system. So our goal today is really that we'll look at some of these factors and ways that we can utilize mind-body modalities in our practices, in our day-to-day encounters with our patients for the greatest benefit. Some of you may already use these. I mean, I certainly don't have any kind of monopoly on practices that you can use. I'm going to mention a few that I use. The chat is available if you want to, or the Q&A, I guess, if you want to send in any suggestions of practices you use, that come to mind, or if you have any questions, by all means, put them through. We'll have some time to deal with those. I would say that, typically when I give this, when I've done this workshop in the past, I've done it in a room, obviously, with people present, typically sitting in a circle so we can all see each other, and a lot of back and forth. The Zoom platform and technology is a fabulous thing and has been a fabulous thing to keep us connected during these times of the pandemic. And also, I recognize some challenges that it might pose for us in having a two-way conversation. So please feel free to utilize the chat. If I see what you've put in there and can bring it forward, I will. I can't promise we'll get to everything that's mentioned in there, but appreciate any kind of interaction that we can have through that modality. Okay. I guess before I start with the practices I want to share, I guess the last thing I would say is with respect to that idea of sitting in a circle. Perhaps that'll be the first practice we can do. So if you just want to either close your eyes or just soft gaze straight ahead and just imagine that all of us in this electronic room right now are sitting in a circle and we really can see each other's faces, see each other's body language, see each other's energy, and be together in that way as we move forward into the rest of this workshop. So I wanted to start with some practices that I've found useful for myself in getting centered and getting connected. So what I mean by this is, after many years of practicing medicine, I finally realized that it's not so much what you do when you're with the patient, but more of who you are when you're in there dealing with people who are coming to you for help and for health issues. So that involves having a few things available to me when I'm in a busy clinic where, it's getting late. You've already seen 8 or 10 or 12 patients. Oh, you got one more to go. How do you stay present for that person? How do you not be distracted by the phone calls, by the nursing issues, by the scheduling issues, by patient coming late, et cetera, et cetera? So I think this is really all about recognizing and being in touch with who I am as a healer and reconnecting to that each and every time. I can't say that I'm successful with that every time in every patient encounter, but that is my intent. That before I go into the room or as I'm in the room, I'm really present. A great teacher of mine once said to me, "If you're going to be somewhere, really be there." So, in this day and age of multitasking and information flying in from all different directions, texts, uh, emails, faxes, whatever, interruptions, many, many different things that can distract you, but just really being present. So here's just a few that I've used. And again, I welcome your comments to share any that you might use as well. Um, I have found, before I see a patient, even before I go in the room now, especially with COVID, you have to wash your hands, right? You have to at least wash with soap and water or sanitize, right, with the Purell or whatever your institution or office uses. And so I found that a 20-second period of time where I can really get myself centered. So for myself, that's a time for what I call a hand washing prayer, or if you want to think of it as an affirmation. But the prayer or affirmation is really just a recognition of the sacred space I'm about to step into. That here's a person who's coming to me because of an issue with their health. And what a privileged and amazingly sanctified position that is to be in, to serve that person and to be in relationship with that person. And so for me, it's a prayer that I say out of my spiritual tradition. but it could be anything, I'm washing my hands in this sacred, to prepare myself for this sacred moment, or I am now fully present as I wash my hands to be present with this person. Something to that effect that brings you back to your center of who you are and why you're there. Similarly, if I don't do it when I wash my hands, uh, it can be done as you put your hand on the doorknob. So I call that the doorknob affirmation or the doorknob prayer. Just a quick pause, right? Before you open the door. That, okay, I'm about to cross this threshold. I'm about to enter into this space with this other human being who's coming to me, who I will be in relationship with, and who I will hope to serve for the greatest benefit of both of us. Uh, Along those lines, sometimes, even if it's not a verbal thing you do, but just a cleansing breath. So, going to see again that last patient of the day, hand on the doorknob, stop, pause, cleansing breath. One breath is all it takes. Sometimes just three if I have the time for it. So I thought that might be the first practice we do together. We'll do a few practices, but so if you can just imagine you're about to go in and see a patient or a client or whatever it is you do, however you interact with people. It obviously, these things can be used outside of your work life as well. If you're about to have a difficult conversation with your boss or coworker or spouse, anything. So if you close your eyes or dim focus straight ahead and just take 3 focused breaths, that's all. Breathing in and breathing out. Just noticing the passage of the air through your nose as you breathe in and out, allowing the breath to just center you, bring you down to base, down to balance. Breathing in and breathing out. And open your eyes after you've done that and just kind of recognize any sense of stillness, calm in your body, mind, heart that just that simple practice did. And, imagine that, going in to see the patient from this place now versus uh, perhaps that place where you were just 30 seconds earlier. So those are very simple centering practices that I use all the time. I do try to use every patient. I cannot say that I'm successful with that, but as often as I can, I certainly do. Another one is a gratitude practice. I'm going to leave that to the end. We're going to close with that. That's on your handout. So I think those are just some of those sorts of examples for self-centering, self-balancing that I wanted to share. Is there anybody who wants to share anything that they do along a similar line, which maybe others in the group might be interested in hearing about? Go ahead and put them into the chat or the Q&A. You can also, I was going to say you can raise your hand. That's another way to do it, but I'm actually not seeing that now. Yeah, so another one that's come through is mindful walking in the hallway. I like that. That's a good one. In my clinic, what happens a lot of times, I'll have one of our pediatric residents will present the patient to me back in the charting room, and then we'll walk down the hallway to see the patient. And that walk is past a lot of people. We're all wearing our masks. We're trying to stay distant, but mindfully walking with the presence of mind that you're about to enter that patient space. It's a good one. Another person mentioned, yes, washing hands as a centering, definitely. Using apps like Headspace. So as a care provider, to be able to take care of oneself through your own practices. You may or may not be able to use Headspace in the moment, as some of those practices we're describing, but perhaps you can. Perhaps you can take a minute to tune into one of the apps on your phone in between patients. Would be another good way to do it, I would imagine. I've not tried that, but it might be a good good thing to try. Thank you for those suggestions. I appreciate what everybody is bringing in. And I think we all develop our own kind of group of practices that we can do and that get us into that good space. Another one, noticing your feet on the floor, support of the chair you're sitting in. Exactly, especially if working in telehealth, where you feel very disconnected. At least I do. um, yeah, feet on the ground, a good grounding practice. And another way I'll use that is feet on the ground combined with a deep centering breath that connects me through the ground, through the building, and into the earth. So you're grounded in the natural world. I found that to be a helpful one as well. Yeah, thank you so much. Those are great suggestions. And here's one more, and then we'll have to move on. So for those who don't know, this is a suggestion from Reb Zalman, who was, may he rest in peace, a very mystical and magical teacher of the Hebrew tradition. When you're entering the temple, which is a good way to look at entering into the room with a patient or a client. When you're entering the temple, you consciously leave all else behind. Exactly. Okay. All right, thank you. Let's move on. We'll get to the next section is I want to talk about how to maximize your presence when you're with a patient. Some of this is similar. The last comment, actually, before I was just as I was moving on, was leading the patient through a similar grounding exercise. So that's a possibility. Ways to maximize your presence. That would be one way. What I'm talking about here again is, if you're going to be present with somebody, be fully present. If you're going to be somewhere, really be there. So it's really about your presence and your connection with the person you're working with. And some of this is sensory, and some of this is very nonverbal, body language, etc. So a couple of the ways I use this is, one is with through the tactile touch. You know, what I've noticed in 30 years of medical practice is that we've moved more and more away from actually touching our patients. You know, and you know, of course, there's the physical exam touch, which is there. When you examine, if you're a medical doctor and you do a physical exam, um, one of the ways is to be so mindful of what you're doing as you're doing that exam, and just being in that space transmits. I remember I was working in a juvenile hall for a while and listening to someone's breath through a stethoscope or palpating someone's abdomen, and just recognizing the sanctity and the privilege of being in that space, and being present with that. Your presence is much stronger. But even short of that kind of touch, I'm often sitting with a little table between patients, and I might just a gentle touch on the forearm as I look into their eyes. Uh, you know, obviously, in this day and age of litigation and all that sort of stuff, it's gotten really kind of a little bit crazy. And yet, you know, I think if done appropriately and gently, it adds to the connection and the rapport. Eye contact is another one, really looking at your patient, really seeing them, and looking at them with the intention of really seeing them, really looking, is another one. It's very easy in this day and age to be even distracted as you're with the patient. You know, I think those of us who deal with electronic medical records, I think you got to beware of the EMR, especially when you're in the space with the patient. I know as a patient, nothing really turns me off more than when my doctor is talking to me, but looking at the computer. So, and typing into the computer. So, you know, right away their attention is distracted. So it's my practice anyway to never look at the computer when I'm with the patient, unless it's for a specific question that came up. Oh, yes, I forgot to check your so-and-so laboratory. Let me look real quick. Okay, da da da. But in terms of getting a history and talking to the patient, just being very present at a good, comfortable distance, listening, listening, and listening. Yeah. I wanted to just mention a few little tricks I learned. So not so much tricks, but I mean, I think we all realize this as we practice in these ways. The usefulness of language and the careful use of language and what a difference it can make. Um, I think I first was made aware of this during that very first hypnotherapy workshop that I did, that my cousin led, that I mentioned earlier. And the field is called neurolinguistic programming, I guess, but that our brains are kind of wired in such a way to hear certain things in certain ways, and that if you say certain things one way versus another, your patient is more likely to be accepting of what you're trying to say to them. So this is part of maximizing your presence also. In general, the general principles are using open and permissive language versus more regimented and lecturing sort of uh, things. So, for instance, for me in my work with diabetes, being open and suggesting that my patient may want to, may is a good word to use, may or can or might want to check a blood sugar before they go to bed, that would, have some benefit for them if they would feel that would, versus you have to check your blood sugar before you go to bed, which immediately sets up the defense of the autonomy. My experience is that human beings will defend their autonomy to great extent, uh, to an extent that probably is not to their benefit, but nonetheless, it is to their benefit from the standpoint of they want to be the ones to decide what they're going to do. So, using kind of suggestive language and open language, such as you may want to, perhaps you can try, perhaps is another good word, or I invite you to try, or these sorts of open words, inviting, presenting possibilities as opposed to prescribing practices, I guess would be a way to say it. The other thing is that if you're a physician and you're recommending a certain pharmaceutical, the one of the basic principles of mind-body medicine is the placebo response. That is, that a sugar pill or a medication which is totally inert and has no biological effects that we know of can actually have great benefit to a person. And this is clearly an activation of a mind body response to the suggestion that the pill might help. This has even been proven if they know the pill is inert and is a placebo, which blows my mind. But that's actually been shown. So there are ways to maximize, I guess I would say, the pharmacologic effects of what you're prescribing with a pharmaceutical. Or another way to think is, or another way to use it is to minimize side effects. So for instance, I use this a lot when I'm prescribing metformin, which has a 25 to 30% reported incidence of adverse effects in terms of gastrointestinal side effects, often fairly minor, but nonetheless often enough to dissuade any patient from using them. So rather than giving them the pill and saying, 25% of people have stomach aches and diarrhea from this. Um, again, being more possessive, uh, there's a possibility you may experience some difficulty with this, but in my experience, most of the patients that use this do perfectly fine with it. And even if they do have the side effect, for the most part, it's very mild. If you have a more significant experience, please let me know. So being open to that, obviously. But prescribing it in such a way that leads to the suggestion that they won't have a problem can activate the mind body placebo effect, right? And since the mind, particularly for GI side effects, the mind and the gut, we know this connection is there. Uh, and so I, can anecdotally tell you I've had less than 25% side effects with metformin, but although I've never formed studies. So anyway, those are just a few of the ideas that I had in terms of maximizing presence, using language in that way, in those ways that maximize things. Um, I'm curious to see if other people have other things they want to share. Kirsten, thank you. She says, when I listen to the lungs, I focus on assessing, contacting, and affirming their vital force. And during one breath, I concentrate on sharing a breath with them. Oh, that's beautiful. I remember, in fact, in the world of hypnotherapy, one of the first thing I learned was how to establish rapport, right, with your client or patient. And one of the simplest techniques is actually mirroring them, and that includes with the breath, so that you synchronize your breath with theirs. And that is really not usually recognized consciously by the patient or person you're working with, but by synchronizing your breath, it really does establish a connection with them that's very nonverbal and very powerful. And what I'm getting from your comment, Kirsten, is also for you, that you are connecting with them in that way and their vital force with that breath. And you don't have to listen for wheezes and rolls on that breath necessarily, right? It's really about connecting with that breath. Yeah. Does anyone else have anything they want to add before we go on to a few more specific mind body practices that we might try together? Oops, I got to get into the Q&A. Sorry, folks. Um, okay, we've covered them already. Thank you. Okay, so for the last part here that I wanted to go through with you is that um, in terms of mind body practices you can use with your patients. So far we've really dealt with what you can do for yourself, right? To make yourself more present, to get yourself centered, to get yourself grounded in interactions with your patient. What can help to magnify or amplify your presence and your experience. Now, the other thing I did want to cover, particularly for those who may be not as mind body practitioners, but these are very simple mind body practices that you can do with your patients in your office. And they can be a very brief encounter or they can be long. I mean, obviously, in a lot of medical encounters now, we have just a very short period of time. We have 15 minutes, 20 if we're lucky. Nonetheless, I think there are times when I've been able to do, say, a guided imagery or guided meditation practice with a patient, as somebody suggested earlier, actually doing a grounding meditation with them. So, I have often done with my patients actual guided meditations with them. And I thought what we could do today is really just have an experience of a very simple one. I have found this one useful. This is a basic stress reduction guided imagery, and used it a lot in my clinical practice as well as in my research in the role of stress in diabetes risk factors. So, stress reduction practice, it's called your safe, relaxing place. And some of you may have experienced this. If we were in the room together and I could see you, I'd have you raise your hands so we could kind of get a feel for the room. If you have experienced this before, that's okay. You can do it again. I'm just going to offer this and experience this. Um, uh, and and suggest to you that if you haven't used this in your practices, I found it very useful if I'm dealing with somebody who's saying having a lot of life stress. Um, Maybe they're having difficulty sleeping. Maybe I deal with a lot of teenage patients. They're having trouble with a parent or a teacher or whatever. They, maybe be having, flat out overt anxiety symptoms. Um, I used this once. I was on rounds with an inpatient. I was the attending for the general pediatric ward, and we went to see a teenage girl, 15, 16 years old, who had been admitted with chest pain and shortness of breath. This was the next morning after her admission. She'd already had an EKG, I think a cardiac echo, a chest X-ray, you know, probably a couple $1,000s worth of medical workup. Of course, everything was normal. When I heard the case presented, I said to my residents, I said, this is a classic case of hyperventilation, anxiety attack, panic attack, whatever you want to call it. And so we went into the room to talk to the girl. And in fact, as we walked into the room, she's right in the middle of an episode. She's hyperventilating. She's looking anxious on her face, etc. And so I just, kind of bent down to her level, got like this, face to face, uh, took her hand in mine, and began to talk her through focusing on her breath, going to a safe, relaxing place. And within 3 to 5 minutes, her heart rate came down. She calmed down. And I think it was kind of a magical moment that I won't forget from the standpoint of teaching the young physicians that was working with on that day, interns, residents, medical students, what is possible through knowing some of these things and these techniques that we don't learn in medical school, right? Um, so one of the handouts that I gave you, if you get to them, you don't have to use it now, but I'm just pointing it out, is actually a script for the guided meditation that I'm about to lead you through. As I said, if you've experienced this before, you can do it again. This is kind of like a 4 to 5 minute time of vacation for us. Let's take a little, give our sympathetic nervous system a little time out. Uh, and just go to a place that represents just comfort and relaxation. So what we'll do is I'll guide you through this practice, very straightforward, focused breathing to begin with, and after a little bit, we will invite a place to form in our mind's eye that represents just safety, comfort, and relaxation, calm, freedom from stress, however you want to think about it, really. I'll use several of those words, if not all of them. And inviting that image to form, a couple of things about the images, about guided imagery. An image is not necessarily just a visual picture, although that's what most of us think about. But images can be have all senses involved. So there may be sounds, there may be smells, there may be tactile sensations. There certainly can be kinesthetic or feeling states, either within the body or emotionally. So all of those are possible, and we'll explore all those possibilities in this place I call your safe, relaxing place. So when we invite this place to form, it may be a place that you've been to before in your waking life that that you've experienced safety or relaxation or comfort. But be open to the possibility that your imagination may just provide you with a new place that's you've never been before. I love to quote Albert Einstein: imagination is more important than knowledge. So even though you know a place where you feel comfortable, let's see, maybe our imagination will take us someplace else today. There was another thought that ran through my mind that now is just scattered. So we'll just let it go. All right. So for this practice, then I invite you, if you're comfortable with it, to close your eyes so you can go inside. If closing your eyes on a Zoom call is not your thing, you can have a soft gaze, dim focus straight ahead, and begin by focusing on your breath. Just noticing the breath in and the breath out. Inhale and the exhale. Noticing as you breathe the rise of your chest, as you breathe in, the fall of your chest as you breathe out. Or if you do abdominal or belly breathing, you'll notice the movement of your belly out with the in-breath and in with the out-breath. Notice the temperature of the air as you breathe in, moving across your nose, cool and refreshing. And when you breathe out, It's a little warmer. So it's as if with each cycle of breath, you're breathing in cool, refreshing, relaxing oxygen, and breathing out any stale tension you don't need right now. And perhaps even connecting to that relationship and that connection with each breath with the trees, as was brought up earlier in the opening ceremony, that we breathe in the oxygen, our relationship with the trees, and we breathe out the carbon that the trees need for their growth and their health. Noticing any sense of calm or comfort already, stillness of mind that's come just through this couple minutes of breath practice. And then in the next breath or three, invite an image to form in your mind that represents a place of just safety and comfort, relaxation and calm, allowing the image to form in its own time. And if it's there already, stay with it and just observe it. Just notice what's there. And if it's not there yet, that's okay. These images can take their time. Just stay open and inviting for that image to form of a place of comfort and relaxation and safety for you, your special place. And even as we move on in this imagery, that image may pop in at any time. And even if it doesn't, just stay with your breath and enjoy the rest of this exercise. So now if your image of your safe and comfortable, relaxing place is there, just look around and notice what you see. What objects are there? What colors? Notice the quality of the light. Perhaps you can tell the time of day from the quality of the light. Notice if you yourself are in the image, and if so, where are you? What are you doing? What is your posture? What is your relationship to the other images that are present for you? Just noticing. Now notice if there are any sounds in your image. Maybe you didn't notice them before, but now that I brought it up, you can notice, are there sounds associated with this image of your safe, relaxing place? Are there any aromas, smells, fragrances? Just noticing. Do you notice any tactile sensations or touch sensations? Maybe the temperature in this safe, relaxing place of yours, or perhaps you notice a breeze. Now noticing if there are any feeling states within your body, perhaps a little shiver or vibration here or there as you're in this place of just comfort and relaxation. Or take notice of any sense of calm and stillness in your mind or body right now as you are in this place, your special place of comfort and calm, safety and relaxation. Just noticing perhaps that calm and stillness and allowing it to even grow and amplify over the next few breaths. So spend a few moments now without my voice in this place of comfort and safety for you. Just experiencing the sights, the sounds, the smells, the feelings of your safe and comfortable, relaxing place. And now noticing again the rise and fall of your breath. taking a last look around your place of comfort and safety, knowing that you can return to this place anytime you wish by closing your eyes and taking a few breaths and just inviting the image and spending whatever time you want in there, a minute or 20 minutes. And knowing that research has shown that just by doing this for about 15 or 20 minutes will lower your cortisol levels by about 35%, calming that stress response in our bodies. Now allowing the image to fade, returning to your breath, noticing the chest rise with the in-breath, fall with the out-breath, becoming aware of the weight of your body in your chair, recognizing again that you're on a Zoom call with a lot of people you can't see, and slowly and gently returning. You can gently open your eyes when you're ready. So that's a very straightforward guided meditation. We took a little longer than possibly you can do in an exam room with your patient, but I've certainly done that dozens, if not hundreds of times with patients, if they're dealing with stress symptoms, if they're just having trouble with a certain health behavior or a certain aspect of their self-care. And it's a very grounding experience. And you can do that literally for 2 or 3 minutes, and you still have 12 to 15 minutes to deal with specific issues from your patient. Somebody suggested earlier that breathing in and breathing out is like being breathed by spirit, however you conceptualize that spirit. And it's interesting because in many languages, particularly indigenous languages, the word for breath and the word for spirit are actually the same word. So I appreciate that comment that somebody made earlier. I think we have about 5 to 7 minutes left for questions, comments, answers, if I have any. Somebody liked the idea of synchronizing breaths. Yes, highly recommend that one. It's a really good practice. A couple people had a nice relaxing experience with that meditation. I always do. If you were having your eyes open for a moment, you might have seen me with mine closed. I always go to a special safe place of mine. So it's always a pleasure to guide people through this meditation. So that's another thing. You as a practitioner, there was the question this morning to Deepak and Lisa about how do you prevent burnout? How do you prevent compassion overload, or whatever the phrase was? And what I found is that by using these practices, I'm really able to inhabit who I really am, and I don't get burned out as easily. And I get burned out when I forget to do these things. So these are all parts of our self-care as well, not just about helping the other, but about helping ourselves. And perhaps very importantly, reminds me of what a friend once said to me, a friend and teacher. In many myths around the world from many different peoples, there's this idea that as humans, our souls come into this world and incarnate into these bodies for a particular reason, to fulfill a particular destiny, to have a particular purpose, whatever it is. And so um, when I think about that idea, and I think about some of these things that I've shared with you and we've shared together today, I think about how they can help us to do what it is we came to do in this world, to be that which it is we came to be. So that idea has a lot of reality and a lot of importance and strength for me. So, okay, I'm seeing there might be a couple of questions. Um, Other practices that have been proven to reduce cortisol. Progressive muscle relaxation. In the script I gave you, there is a version of progressive muscle relaxation that I use. And there was a paper written by, I think the last name was Paulo, Pawlow. I believe that was the modality that they used, but breath work, in our own studies, in my own studies with teenagers, even just the relaxation breath, progressive muscle relaxation, and the guided imagery all led to comparable reductions in cortisol levels. It was interesting. So a good question: if someone has difficulty conceptualizing their safe, comfortable place, how might you guide them to it? Really good question. In fact, sometimes I don't use the word safe right away because, at least in my patient population, some of the kids really haven't had a safe place. Uh, but that's why comfortable or relaxing is better. And I always, uh, if they haven't done this kind of visualization before, it may be difficult for them to get to. So again, I'm using that permissive language. It's fine if you don't get the image. If all you have is the breath, that's beautiful and that's all it's meant to be. So just kind of guiding them in that way, step by step, so they don't feel like, oh, they have to achieve a certain level of imagery before they can be successful. Setting the bar low, particularly at the beginning. Usually if I'm working with patients, the first thing I'll do will be just the breath work. And then if I'm seeing them in repeated sessions, then I might bring in more of a fuller imagery and guided meditation experience. Great question, though. Thank you for that. And thank you for the comment from Joy about using a singing bowl and uh, playing a few rounds with her wand on the Tibetan bowl. I'd love to hear that. Uh, yes, beautiful. Thank you for all of your comments. I appreciate that. If you want to connect with me, I think my email's on the handout. If it's not, it's my last name, Weigensberg, up to the B, Weigensb at usc.edu. And I think we have to end the session now. Thank you all very much for coming. Have a wonderful rest of the day and be well.